Hi, my name is Heather. My student ID is 3062514, and today I'll be performing the Nursing Foundation's 2003 ESPN checklist for initiating a secondary line. So before performing my lab, I would have gone through any patient teachings with my patient, providing some privacy for them, going through any allergies, medical history, and medication history, making sure, or just verifying the MAR, doing my 5 medication rights before administering, the 5 after, and also going through my 4 medication checks. And also just making sure that my patient is comfortable at all times throughout this procedure. So now I'm going to get started just with hand hygiene. Now that my hands are dry, I'm going to be grabbing my secondary line tubing, doing a banana peel method like this. Grabbing this like so and making sure that this is locked. Perfect. Putting this off to the side. Next I'll be grabbing my medication, peeling it out of the bag here, grabbing it, verifying that it is right, and then hanging it up. So it is above the primary line. I will also be performing more hand hygiene. Grabbing my secondary line tubing, and here I'll be doing the push twist method, making sure that there are no kinks in the line, that there are no rips, that it's fully intact. Perfect. So now what I'm going to do is I'm just going to fill my little canister here till from like 1/3 to 1/2 of solution. Perfect. Before I carry on, I am going to put on my medication label and also my medication tab that goes through the date, time, my initials, the type of line, and the solution. And I would normally wrap it around. So now what I'm going to do is I'm going to prime my line, making sure that the medication is going fully through the line but not exiting the line. And throughout this, I will make sure that there are no air bubbles. So I'm going to get started. Perfect. So it's nice and slow. Perfect. So now I'm going to lock it. And I will hit any bubbles out. Perfect. Okay, so now what I'm going to do is I'm going to connect the 2 lines. So I'm just going to grab an antiseptic swab and just clean this port on the primary line. Discarded this. I would have cleaned that for 30 seconds and let it completely dry. Since this is sterile, at any time if I were to touch the end with anything, I would have to replace it and then reprime, but I'm going to connect the 2. And at this time, I would have done the proper calculations for the drip rate and making sure that the flow is working properly and that there are no complications. So this is my Nursing Foundation's 2003 ESPN checklist for initiating a secondary line. Thank you so much.